Good morning. So, working on my client, stroke survivor, hemorrhagic stroke survivor, and I've been using, or I used my SCENAR device and my electric conducting glove on his affected foot, which there's been some problems over the years. He's almost 4 years. He's beyond 3 years, less than 4 years post, and the muscles of the foot wasn't mobile. He couldn't feel his feet. He couldn't feel his foot or his toes specifically when he was taking steps, so it wasn't giving him a proprioceptive and kinesthetic sense of where his foot was, or unless he jammed his foot down, and it would be painful because he slams it down. So I did manual therapy on the fascia and musculature of the foot, mobilizing the ankle with the electrode anchored on the superior aspect of the tibialis anterior and the glove connected to the other lead. And my client walked, got up and walked. Following that, I can feel my toes striking the ground. I can feel my toes while I'm walking. He could not feel them for almost 4 years. Exercise alone did not do that. Bioelectricity, engaging the tissues, opened up the neurologic channels for his brains to see the tips of his toes. That's what the Avasia, the SCENAR, dare I say, and plus the newbie are good for. They're opening up sensory channels. So in neurologic rehab, in order for people to feel, if you can feel, what do we got? Sensory, afferent in, motor, efferent out. It's happening, people. And I'm not just a mad scientist. I'm using applied knowledge in specific patterns to help my clients. So the next series of videos following me running my mouth are me explaining to him what's happening, and you're seeing what's happening with his foot as I do this massage, which was basically 20 minutes. 20 minutes, and this man can feel his toes, and he hasn't in almost 4 years. There you go. Let's see.
So you're just like tickling my feet?
Yeah, you run your finger across the bottom of the foot, and you're checking for consciousness. And when you give it, so the current's off. So when I go onto the bottom of your foot, it's making your toes fawn open. So that is the Babinski reflex, because it's a bad reflex because you're supposed to claw down at my finger. You're supposed to close your hand down or close your toes down at the response, not go up. So, but you've had a neurologic insult.
Yeah, plus when you just did that, I could feel
that.
Yeah,
that's a stretch, yeah?
Yeah, that's a real stretch.
Yeah. But when you hip flex, when you engage your hip flexors, go ahead, pull your knee up. You engage your tibialis anterior, so you can see the tendon tightening, which is pulling the toes and dorsiflexing the ankle and pulling the toes up. So you're getting the appropriate response we need when you're walking, but you just sitting here in isolation, you don't, because you felt the Babinski reflex because of the neurologic insult. So you see how your toes are responding to my fingertips running across the fascia and the musculature of your toes.
Yeah, they're just sitting there.
No, they're moving. Watch. See? It's not just see.
Oh, wow.
Yeah. So
Okay.
This is opening. So your voluntary control over your toes is inhibited. It's neurally inhibited. It's called neural inhibition. So if I want to, as I said the other day, neurally engage bioelectrically with opening the channels up. One, this is a DC style current. This is opening the fascia, which the fascia has its own nerve supply and smooth muscle cells. So I'm opening it up so we can mobilize the atrophied, you're 3 years post, thereabouts, right? Almost four. Yeah. So now, yeah. Think about 4 years And how many times have I massaged the bottom of your foot? Not, yeah, maybe a couple times just to kind of move some things around, but not, definitely not like this. So 4 years of not being mobile, other than you walking on it with a brace on, now I'm getting in there and I'm splaying things open. I'm opening the channels bioelectrically, chemically, biochemically, and mechanically. This is going to improve your walking. This is going to improve your contact with the ground as you take steps. You know, this is part of that sensory feedback. One, the proprioceptive feedback of knowing where you're supposed to be in space.
Right.
When you feel the ground under your foot and you know where you need to toe off, where you need to push off at. Mm-hmm. And the toes kind of claw at the ground to give you that stability through the ankle. Yeah. Right? So this mobility right here needs to increase. We got to slowly work that free. So see how it's starting to go more and more, and I'm not torquing any more than I started. But we got to get your ankle doing this a little bit and doing that.
Roll if I do that.
No, it'll roll if you misplace a step. But your ankle is so tight on its own. Remember, if you walk with your shower shoes on, or you walking at next step without anything on your foot, you have a greater propensity to roll it there and in those circumstances than when you're walking with me with no cane at all. So I'm going to help activate the muscle tissue so it better supports. This is sending a signal up your muscles, up the nerves, up to your brain and back down. I'm going to better help you better engage and support yourself neurologically, bioelectrically, so you can send the signals down there and they can receive it and respond. Sometimes just doing the activity without any type of electrical intervention just means you're just going through the motion and your tissues may or may not respond. But now we're driving the process to say they have to respond based on what's happening. You're not giving them a choice.
Because you're manipulating.
Because I'm manipulating the system. You know, with the right, so this right here, this dorsiflexion, we're going to help get this to,
doesn't hurt anymore.
Good, see, no pain. Doctor, no pain. Doctor, no pain. Doctor, no pain. Now, if I clamp my fingers and dig into the bottom of your foot, but you can do that to anyone. I could take and grab a hold of anybody's any part of anyone's body and squeeze with my strength, and they're going to, hey, get your hand off me or stop that. But when we're manipulating tissue, we find the spots that need attention, and we just work it free.
That is going up my tibia.
Okay, going up tibialis anterior. Yes. So when I originally grabbed it, it was painful as all get out. You could feel the knot in the
you were breaking my toe.
the fascia in the bottom of the foot. Now that I've done this for it, I mean, it's barely been about 5 minutes to see. Yeah, 3 minutes with the device running. So a few minutes just by hand without the device, and then now 3.5 minutes with it running, and it's calming completely down. Okay. Feel the current? Good. Traveling up the leg or just locally? Okay.